Thank you for listening to Depictions Media Radio. Yeah, we have a report from Karen Hogan, the Auditor General, and she's going to be talking about the federal government and services to the indigenous communities with regards to COVID-19 and personal protective equipment and other services needed to support people who have been hit hard by the pandemic, and of course talking about things like budgets and things like that, and other aspects that go into figuring out how to support people during a time of emergency.
Good afternoon. We're here today with Auditor General Karen Hogan to discuss the two most recent audit reports of the government's response to COVID-19. Madame Hogan will deliver a short opening statement before we open up the floor to questions.
Good afternoon, bonjour. Merci de vous joindre à moi. J'ai présenté aujourd'hui au Parlement les résultats de deux nouveaux audits de la réponse du gouvernement à la pandémie de COVID-19. The first of the audit reports I've released considers how the government acquired protective and medical equipment during the pandemic. The second looks at how Indigenous Services Canada provided the protective equipment and healthcare workers that Indigenous communities and organizations needed to respond to COVID-19. Both audits showed that there were issues in planning and stockpile management before the pandemic. For example, in our audit on procuring personal protective equipment and medical devices, we found that before the pandemic, the Public Health Agency of Canada had not addressed long-standing known issues with the systems and practices used to manage the National Emergency Strategic Stockpile. L'Agence était au courant de ces problèmes, qui avaient été soulevés dans des audits et examens depuis plus d'une décennie. L'Agence de la santé publique du Canada n'était donc pas aussi préparée qu'elle l'aurait dû l'être pour faire face à l'augmentation du nombre de demandes d'équipement provenant des provinces et territoires sous l'effet de la pandémie de COVID-19. Dans notre audit de service aux Autochtones Canada, nous avons constaté que le ministère n'avait pas suivi sa propre approche pour stocker sa réserve d'équipements d'urgence, de sorte qu'il lui manquait certains articles lorsque la pandémie a éclaté. Cependant, en même temps, ces deux audits ont relevé de l'agilité et de la réactivité. Overall, the Public Health Agency of Canada, Health Canada, and Public Services and Procurement Canada helped address the needs of provincial and territorial governments for personal protective equipment and medical devices. Indigenous Services Canada did the same for Indigenous communities and organizations. Faced with a crisis, these organizations worked around their outstanding issues with the management and oversight of the emergency equipment stockpiles and adapted their activities. For example, during the pandemic, the Public Health Agency of Canada approved how it assessed needs and allocated equipment to help meet the demand for personal protective equipment and medical devices from the provinces and territories. It also outsourced much of the warehousing and logistical support needed to deal with the exceptional volume of purchased equipment. De même, Santé Canada a réagi à la demande accrue due à la pandémie, en modifiant sa gestion des demandes de licence des fournisseurs d'équipements de protection individuelle et d'instruments médicaux. Services publics et Approvisionnement Canada a aussi fait des ajustements et assumé certains risques pour faciliter l'achat rapide de grandes quantités d'équipements dans un marché hautement concurrentiel où l'offre ne suivaient toujours pas la demande. Si les ministères n'avaient pas ainsi adapté leur approche aux circonstances, le gouvernement n'aurait probablement pas pu obtenir le volume d'équipement nécessaire. Indigenous Services Canada also adapted quickly to respond to the pandemic and relied on the National Emergency Strategic Stockpile to fill pre-existing shortages of items in its own stockpile, such as gloves and hand sanitizers. The department supplied Indigenous communities and organizations when provinces and territories were unable to provide them with personal protective equipment. The department also expanded access to its stockpile beyond those directly supporting the delivery of health services to include police officers and people in communities who were sick with COVID-19 or caring for a sick family member. Face à l'augmentation de la demande de soins de santé due à la COVID-19, Services aux Autochtones Canada a rationalisé ses processus d'embauche de personnel infirmier destinés aux collectivités éloignées ou isolées des Premières Nations. Le ministère a aussi mis à la disposition de toutes les collectivités autochtones du personnel infirmier et paramédical engagé à contrat. Tandis que le ministère prenait ces mesures pour augmenter sa capacité, le nombre de demandes de personnel infirmier et paramédical continuait d'augmenter. Services aux Autochtones Canada n'a donc pas été en mesure de répondre à plus de la moitié des 963 demandes d'effectifs supplémentaires qu'il a reçues entre mars 2020 et mars 2021. Nos audits de la réponse du gouvernement à la pandémie continuent de montrer que lorsque les gens qui forment la fonction publique fédérale sont confrontés à une crise, ils savent se mobiliser et mettre leur effort à répondre aux besoins de la population canadienne. Cependant, ces audits montrent aussi que les problèmes qui sont oubliés ou qu'on néglige de régler ont une façon de ressurgir et qu'ils le font généralement au pire moment. Canada was not as well prepared to face the pandemic as it should have been had the stockpile of emergency equipment been better managed, and if a long-term solution had been put in place for healthcare workers, such as nurses in Indigenous communities. If there is one overall lesson to learn from this pandemic, it's that government departments need to take action to resolve long-standing issues and to see the value in being better prepared for a rainy day. Thank you. I'm now prepared to answer your questions.
Thank you, Madame Hogan. We will now go to the floor and the phone for questions. Please state your name and your media outlet, and we'll stick to the standard model of one question and one follow-up. Operator, do we have any questions on the phone?
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, Ryan Tilmalty, National Post. Your line is open. À vous la parole.
Yeah, good afternoon. I'm wondering, in your report, you highlight the problems with the national stockpile. You mentioned audits in 2010 and 2013. Was there any work done after 2013 to try to address these problems, or were they, systemically ignored all the way until last year?
So in your question, you referenced some internal audits that the Public Health Agency of Canada had completed, the first back in 2010. The department did a follow-up of that in 2013. That follow-up audit found that some action had been taken, but most of the significant findings had not been addressed. When we came in to do our audit, we found again that those problems remained outstanding. They were items like determining the needs assessment, so how much basic equipment should be in the National Emergency Strategic Stockpile. They hadn't addressed the issue on the IT systems, on how to better manage them. So at times we saw that items, expiry dates were not tracked, and hence action could not be taken. And so those longstanding issues are really what resulted in the National Emergency Strategic Stockpile not being prepared to deal with the increase in demand when the pandemic started.
Provinces are, of course, responsible for healthcare here. Was there adequate conversations between the federal and provincial governments over what might be required in an emergency, and was there adequate, I guess, coordination of what was in the federal stockpile versus what might have been in provincial stockpiles?
So you're absolutely right in your question that provinces and territories are responsible for the management of healthcare services, and that includes managing their own individual stockpile. So each province and territory has a stockpile that they should turn to first in the case of an emergency. They then also have to try and procure equipment to add to that stockpile. When they can't meet those needs, that's when they turn to the National Emergency Strategic Stockpile managed by the Public Health Agency of Canada. So at the beginning of the pandemic, what we saw is that there wasn't a very good sharing of information between the provinces and territories, but we definitely saw that improve throughout the pandemic. So they came to the table to discuss what was in provincial and territorial stockpiles, what their emerging needs might be, how their own provincial guidelines might influence their needs going forward. And so there was really an evolution throughout the pandemic, but at the beginning, it wasn't as effective as it should have been.
Operator, do we have a second question from the phone before going to the floor?
Thank you. Merci. The next question, Marieke Walsh, the Globe and Mail. Your line is open. À vous la parole.
Good afternoon. Following up on Ryan's questions, I'm sorry if I missed this in the report, but I don't see anywhere in the report an accounting of exactly how much, surgical masks N95 were in the federal stockpile, say on March 11th when the pandemic was declared internationally. Do you have that information? And if so, can you share it?
So as you can imagine, our audit started in very recently, actually, a few months ago. And so we weren't able to be present to be able to count what might have been in the stockpile in middle of March. What we found as we started to audit was that deficiencies in the agency's system were such that it didn't have complete and accurate data about what was in its stockpile. And so we did make a decision to stop looking at what should have been there and what all those deficiencies might identify and focus on how the government reacted and tried to overcome the deficiencies. But it was clear that the stockpile at the beginning of the pandemic was not sufficient to meet some of the earlier requests that were received in February and March from provinces and territories.
Thank you. So just to clarify from that, there was so little information from PHAC that your auditors could not establish those baseline numbers. I understand you obviously weren't monitoring in February 2020, but you couldn't get that clear information in retrospect. Is that what you're saying? And can you explain then if the stockpile was at all functioning how it should have been?
So what we found is that the quality of the data was such that we couldn't rely on what the agency estimated was the stock on hand, and hence focused on, when it's bad, let's not focus on how bad is it and why did it get to the situation it got to, and focus on how to move forward. What we did see, however, during the audit is there were officials had told us, and we reviewed documents that clearly indicated that budget constraints had impacted the agency's ability to determine the needs assessment, so assess how much should be in the stockpile, but also to fix its system or to even acquire goods as they may expire or be used coming out of the stockpile. So it really wasn't a reliable starting point, and hence why we didn't give an accounting of what was in the stockpile before the pandemic.
Thank you. Going now to the floor.
Thank you. David Aiken, Global News. Good afternoon. Before the pandemic hit, the government had clearly already failed, as you've noted, in not preparing that stockpile. That aside, I wonder if you have an opinion about how the government writ large reacted once it recognized it needed to quickly procure equipment. We have 3 government departments, agencies. They all responded in different ways, rewriting processes, changing rules. You note that helped procure equipment, but I wonder if you could put a little color. Was it a good job, bad job, creative job? What's your thoughts about how the government responded, broadly speaking, to the objective of now we got to find PPE and find it quickly?
So you're absolutely right. The National Emergency Strategic Stockpile was not prepared to respond to a pandemic, and that was mostly because the Public Health Agency of Canada had not addressed long-standing known issues. But what we did see was that the government was quite reactive and flexible, and we did see Health Canada and the Public Health Agency, as well as Public Service and Procurement Canada, come together and collaborate. So what we saw was the establishment of a long-term national supply and demand model to estimate needs, which had never existed before, the move to bulk procurement. PSPC took on some additional risks as it moved to that bulk procurement. The ability of the agency to outsource some of the warehousing to deal with the big volume that was being purchased and needed to be managed and then distributed. And then finally, we saw a scarce resource allocation strategy that was developed in order to help determine how personal protective equipment would be allocated when the purchases didn't meet the demands. So when you put all that together, that's a really good reactive response to a situation. What the government now needs to do is be better prepared and have that agility sort of baked into its processes as we look forward to the next health crisis or next national emergency that might be ahead of us.
One of the things that the public and parliamentarians often turn to the Auditor General for is the question, did we get value for money? And I found that missing, particularly when we looked at the PSPC contracts. Lots of them were signed. You had some commentary about the speed at which, from date of contract signed to first deliveries. But unless I missed it, I didn't see a lot of thought about, or maybe this is outside the audit, did we get value for money? We did know there were circumstances where swabs from China were delivered. We opened the box up and they were all spoiled. There was language in contracts to get money back for that sort of thing. But overall, does your office have any opinion about, did we get value for money in the $7 billion we spent on PPE last year?
That's an excellent question, and we will be auditing in detail the cost during the public accounts audit, which is the financial audit of the Government of Canada. But I think you have to put yourself back in the context of the market that we were in, where there was a global increased demand for personal protective equipment, where the supply was often not keeping pace with that demand. In that market, you know that prices are going to go up. We didn't do any comparisons with provinces or territories or other countries. And what we were focusing on was, did the government take the right approach in order to secure personal protective equipment to meet the country's needs? And that's why we focused in on the timeliness as well as the quality of the equipment that might be received, and looked at Health Canada's and public health agencies' testing and quality assurance process. It's really hard to know if you paid the right price because the market here was setting that price, and the market was such that to come to the table at times, the government had to even prepay. So it really wasn't a traditional market to determine a good price comparator.
Going now to a second question from the floor.
Hi, Stephanie Taylor with the Canadian Press. Thank you. I suppose it's a bit of a yes or no question, but has the government to date fixed the long-standing issues that led to the issues with the national stockpile in the first place? The issues with the data, the systems that allowed it to get to the state it was in when the pandemic was declared in March 2020?
So if you're asking me today, have they addressed those longstanding issues, the answer would be no. What we saw them do was work around those issues and shortcomings in order to mobilize a response to support provinces and territories throughout the pandemic. So there is the need now to deal with these issues post-pandemic and to consider how to ensure that there's flexibility. So, I mean, the first place is what's your baseline stock of what kind of equipment you should have, and then how do you ensure that you can maintain that? What system do you need to support it? And how do you ensure that agility and flexibility is baked in to processes going forward?
You mentioned that Health Canada and the Fed stepped up to the challenge once the pandemic arrived to get PPE and equipment out to provinces. But early on, we were hearing reports from healthcare workers of having to reuse equipment, and there was such a lack. So, do you think Ottawa, the federal government, PHAC, responded to those PPE needs from provinces early enough?
So early on in the pandemic, I look at February and up to mid-March, there were requests that came in from provinces and territories for personal protective equipment. And the federal government was able to address those needs to a very small fraction. They didn't have the equipment in the stockpile to deal with those needs, which is why there was a quick movement to bulk purchasing. The bulk purchases started to arrive in April, so there was definitely a time between the beginning of the pandemic and early April where a large part of the needs were not being addressed. But that was taken care of as the pandemic progressed.
And going back now to the telephone, do we have questions, operator, please?
Thank you, merci. La prochaine question, our next question, Mélanie Marquis, La Presse, your line is open. À vous la parole.
Merci. Bonjour, Madame Hogan. J'aimerais revenir sur l'Agence de la santé publique du Canada. Vous, dans votre rapport, vous parlez d'une gouvernance défaillante. Visez-vous une personne en particulier, une division précise au sein de l'agence, ou c'était vraiment quelque chose qui était systémique et qui a été ignoré essentiellement par le gouvernement?
Personnellement, à mon avis, c'était plutôt systémique. Quand il y a un rapport d'audit interne daté de 2010 qui relève des lacunes et des recommandations qui devraient être adressées, la responsabilité est avec le sous-ministre de l'agence, ainsi que les hauts dirigeants de l'agence, avec une surveillance de leur comité d'audit pour s'assurer qu'ils adressent les lacunes et qu'ils mettent en place leur plan d'action. Et alors, pour voir qu'une décennie plus tard, ces lacunes-là n'ont pas été adressées, c'est pour cela que nous avons constaté qu'il y avait une manque de gouvernance. Mais je dirais que c'est plutôt à plusieurs niveaux et pas nécessairement un individu. Mais il faut toujours se dire que le sous-ministre est responsable de toutes les actions du ministère.
Oui, puis juste pour, j'aurais dû poser la question dans le même triple barrel question, mais est-ce que vous êtes d'avis que les problèmes de gouvernance sont réglés? Puis sinon, ma vraie question suivie, c'était par rapport à Approvisionnement Canada. Vous avez parlé d'un risque qu'on a pris des paiements qui ont été faits à l'avance pour se procurer de l'équipement de protection individuelle que tout le monde s'arrachait. En êtes-vous arrivé à la conclusion que c'était un risque calculé, qu'on n'a pas trop qu'on n'a pas fait preuve d'irresponsabilité avec l'argent des contribuables?
Alors, quand ça vient à la gouvernance, je ne sais pas si ça a été adressé. Comme j'ai mentionné auparavant, on a regardé la situation avant la pandémie, réalisé que les lacunes n'étaient pas adressées, et alors on a mis notre emphase sur les actions qui ont été prises pour adresser le problème que tout le monde faisait face, qui était la pandémie, et répondre aux besoins des provinces et des territoires. Quand ça vient à Services publics et approvisionnement Canada, oui, ils ont accepté des risques. Ils ont invoqué l'exception de sécurité nationale qui permet la passation de marché sans processus concurrentiel. Et ils ont aussi accepté les risques qui viennent avec des paiements faits à l'avance. On a noté quelques recommandations et points d'amélioration, mais dans le global, l'approche utilisée dans le contexte et le marché était raisonnable pour assurer que le Canada pouvait avoir des équipements de protection personnelle et des instruments médicaux.
Parfait, merci. Opératrice, passons à la prochaine question au téléphone, s'il vous plaît.
Thank you. Merci. Our next question from Tom Korski, Block Lock Reporter. Your line is open. À vous la parole.
Thank you, Ms. Hogan. What is the value to date, not anticipated collections through litigation, the value to date of payments for goods that were not received?
So in our audit, we looked at 39 of the 85 contracts that Public Health Agency issued in order to secure personal protective equipment that we scoped in. So gloves, masks, gowns, testing swabs, and ventilators. So there are many more contracts in addition to the 85 that were in the population that we would have looked at. In our sample, we came across one contract where prepayment had occurred and that the goods had not yet been received. But we did note that Public Service and Procurement Canada had already begun to take action to recover those funds from the supplier. As we noted in our audit report, there was about $618 million out of the contracts that we looked at that were prepayments. But in most instances, except for that one that we found, the goods had been received.
Forgive me, Ms. Hogan. I was looking for a dollar figure. You didn't answer my question. If you have a dollar figure, please let me know. Problem with your audit. It's contradicted by documents that are on the public record, madam. We just know through, you state, for instance, internal documents noted budget limitations. That's directly contradicted by Sally Thornton, the vice president, who was responsible for the warehouses. She said the exact opposite twice in committee testimony before she abruptly resigned. The documents on the public record show the agency was mandated to store a 4-month supply of PPE. That was their job. You don't mention they closed 3 warehouses. You don't mention they threw away 9 million items. And you don't mention that 2 executives abruptly resigned. Forgive me. These are all documents on the public record. It's as if you audited the Titanic, but you just picked it up from the part where they served cocoa to the survivors. Do you not see how haphazard this audit is? Did you not look at the documents on the public record? How could you come to this conclusion?
So I'll answer your first question. I do not have a total dollar figure where contracts were awarded with prepayments and goods not received. During our audit, we saw a great deal of documentation and spoke to officials who told us that prior to the pandemic, the concerns with the National Emergency Strategic Stockpile had not been addressed because of budget constraints, that they hadn't done their needs assessment, that they hadn't properly replenished items in the stockpile, and that they had put on pause a business case in order to replace the IT system to manage the strategic stockpile. Following the pandemic, we did see that there were large increases in warehousing capacity in order to deal with the large volumes. We ensure that we always collect sufficient and appropriate audit evidence to support all of our findings, and I very much stand by the excellent work of the audit team and my office.
Going now to the floor.
Stephanie again with the Canadian Press. I'm curious to know, in your assessment, did you look at whether the government ordered based on need? Like, for example, we have plenty of ventilators which haven't been used and which have been sent overseas and to province, and we did get a surplus of that. So did you assess whether the PHAC ordered on the basis of need or how they determined where they got to the numbers they did?
Absolutely, we did look at that. So at the beginning, the Public Health Agency was basing their orders for bulk procurement on requests for assistance that had been received from provinces and territories. And then they quickly realized that they were missing information. So they were missing the information of what provinces and territories had in their stockpiles and why their needs were where they were, and what the guidelines were going to be in each province. And that's why they developed the long-term national supply and demand model. So there was a third-party service firm that helped them develop that, and it has tons of data that's put in there that uses the per capita population, the positivity rates, epidemiology, as well as guidelines as to how many masks are needed for certain procedures and so on. And that's what then informed, come the summer of last year, the bulk procurement. But at the beginning, it also was, if we need 500 masks and we can get 1,000, let's buy those 1,000. So there was a little bit of making sure that we had extra stock in the stockpile, but once they were able to develop that model, that's what really informed the decision-making going forward.
Turning over to your report on Indigenous Services Canada, you said that it was unable to meet more than half the demands for nurses and paramedics from Indigenous communities despite efforts to streamline its hiring processes. Why was the department not able to meet this demand?
Well, I think like everywhere else across the country, the demand for nurses was growing exponentially, and there was quite a shortage. But here I would point to really a long-standing issue that exists with having access to proper health care in Indigenous communities. Indigenous Services Canada is responsible for delivering the health care to 51 remote and isolated communities, and there were already shortages in meeting the needs in a non-emergency time. And so the surge, an increase in demand, was such that even though they had streamlined their hiring processes, signed new contracts with nurses and paramedics, they were still not able to meet the increase in demand to ensure that all Indigenous communities, because they had opened up all of these contracts to everyone, not just the 51 remote and isolated communities, and that exponential demand, they just couldn't meet it.
Turn it back now to the phone. Thank you.
Thank you. Merci. The next question, Boris Proulx, Le Devoir. Your line is open. À vous la parole.
Oui, bonjour. Dans votre rapport, c'est assez clair que le gouvernement ne savait pas combien d'équipements de protection d'urgence il devait accumuler dans la réserve. Mais est-ce que j'ai bien compris que vous avez dit en anglais qu'il ignorait aussi combien de ces équipements-là il avait en réserve? Par exemple, est-ce que ce serait juste de dire que le gouvernement ignorait combien de masques il avait dans sa réserve d'urgence?
Alors, je pense que j'ai bien compris votre question, mais oui, au début de la pandémie, on a constaté que la réserve, l'Agence de la santé publique Canada n'avait pas une exactitude de tout l'équipement qu'ils avaient dans leur réserve nationale, en raison des lacunes qu'ils n'avaient pas adressées, qui avaient été identifiées en 2010 dans un audit interne. Les lacunes incluaient un système de technologie qui n'avait pas toutes les données, ou les données n'étaient pas toutes inclus dans le système. Par exemple, il n'y avait pas un suivi sur les dates d'expiration de masques. Et alors, sans les dates et sans un suivi sur les dates d'expiration, c'est impossible que l'agence puisse prendre l'action pour adresser si la date arrive ou s'il y a un manque. Et alors, à cause des lacunes, on a décidé de pas faire une comptabilité de tout ce qui était dans la réserve nationale, mais de vraiment mettre l'approche sur les actions prises par le gouvernement pour adresser la croissance des besoins et des demandes des provinces et territoires.
J'ai compris aussi qu'il y a eu des progrès faits pendant la pandémie. Est-ce qu'on peut dire qu'aujourd'hui, cette question-là a été réglée? On sait aujourd'hui, le fédéral sait aujourd'hui combien d'équipements il a dans sa réserve d'urgence?
Mais alors, ils n'ont pas adressé les lacunes qui avaient été identifiées en 2010, mais ils ont vraiment changé leur approche. Et ils ont un nouveau système qui gère l'équipement qui est dans les entreprises de tierces parties qui sont gérées par des tierces parties, mais il y a encore des problématiques avec le système. Et alors, c'est vraiment, ça représente vraiment le besoin d'investir dans quelque chose qu'on ne voit pas, d'investir dans un système de technologie qui appuie un programme où ici la réserve est très important. Et c'est vraiment ça qui manque. Il y a des problématiques, mais on a vu que ça l'a amélioré durant la pandémie. Alors, ils sont dans une meilleure position maintenant qu'ils l'étaient, mais ils n'ont pas adressé les lacunes qui existaient en 2010.
Opératrice, nous allons continuer au téléphone, s'il vous plaît.
Merci. Thank you. La prochaine question, our next question, John Paul Tasker, CBC News. Your line is open. À vous la parole.
Oh, hi there. Yeah, thanks for taking our question. So you essentially found that PHAC ignored these two internal audits about the sorry state of the strategic stockpile. How did the agency's management justify this? Like, what was their explanation for basically turning a blind eye to these issues, not once but twice? Did they point to anything other than budget constraints to explain this, which, basically is malfeasance on their part?
So they did address a few of the recommendations. I just wanted to make sure that that's clear. They didn't address, however, the most significant ones, which still existed at the time that the pandemic started. From our discussions with officials and the review of the internal documentations, the main justification or reason behind this was budget constraints. And I would presume the fact that the stockpile is not used very often, but that just demonstrates the importance of investing in it. If I could give you an example, you don't wait for a rainy day to rush out and buy an umbrella. You take the time, you invest, you have the umbrella in your closet, and that's exactly what the National Emergency Strategic Stockpile should be. It's Canada's umbrella for a rainy day. So the agency needs to take the time to invest in that going forward.
You also found that that PHAC did not track the age or the expiry date of some of the equipment. Do you have any hard numbers on this or any estimates as to how much of the stockpile's equipment was obsolete when the pandemic hit last year?
Unfortunately, no. What we found is that the quality of the data was such that from an audit level of assurance, we couldn't, stand behind the numbers that were there. What we did find, however, is that often they didn't track the expiry dates in the system at all. And hence, you couldn't take action if it's not in your system in order to help you figure out how to dispose of them or use them in a different way.
Operator, we'll continue on the phone.
Thank you. Merci. Our next question, Kristen Hkure, CTV News. Your line is open. À vous la parole.
Hi there. How should Canada specifically prepare for a rainy day ahead, and what should be done? PHAC is committing to having a plan for the stockpile 1 year out from the pandemic. Is that acceptable for you? And is this 1 year time frame adequate, or should this happen much sooner?
Well, I'm not sure that anyone can predict when the pandemic will be over and what that 1 year from the pandemic will be. I do recognize that everyone right now is focused on continuing to meet the needs of provinces and territories as we are still very much in the middle of a pandemic. How do you go about addressing that? Well, I think the first thing is that you start off on determining how much of certain elements you should have in a stockpile for protective equipment. For example, N95 masks were very important in an airborne illness like COVID-19. That might not be the case in the next health emergency. So you do need to establish, threshold of the baseline of equipment that you should have in your stockpile. Then it's making sure that you've fixed your system to properly track it, that you've properly funded it, and that you've built in some flexibility and access to additional warehousing, additional supplies, increasing Canadian domestic capacity to manufacture these things. There's so much that needs to be done to be better prepared, but it starts with establishing that baseline of what you might need in the stockpile for an emergency across the country.
Thank you. No follow-up.
Opératrice, est-ce que nous avons d'autres questions en attente?
Oui, thank you. Merci. Next question, Zach Visera, Saskatoon Star Phoenix. Your line is open. À vous la parole.
Thank you so much. Auditor General, I note that your report on Indigenous communities obviously goes through that PPE stockpile that ISD was managing. I'm also aware, though, that ISD provided millions of dollars in funding to some Indigenous organizations and communities for them to procure their own PPE. And I guess I'm wondering, why wasn't that included in this report? And do you have any idea of how that money was managed and whether it met the needs of First Nations communities?
So First Nations communities have many ways to get access to personal protective equipment. As I mentioned earlier, they should go to the province and territory first in order to try and get equipment there if they have their own little stockpile that's been used up. When the provinces and territories don't have in their stockpile, they go to the National Emergency Strategic Stockpile. And then in exceptional circumstances, when Indigenous communities cannot get the personal protective equipment that they need from the province or territory, they can turn to Indigenous Services Canada and access the stockpile that they have there to meet the needs. We focused in on that because it was linked very closely to the bulk procurement that was being done for all of the provinces and territories. You did mention the additional funding that the federal government had given Indigenous communities to buy their own PPE. We did not look at it at this time because the accounting back to Indigenous Services Canada isn't due until the end of this summer. So there really was no information available within Indigenous Services Canada for us to look at whether or not communities used it to purchase personal protective equipment in addition to what they were accessing either provincially and territorially or from Indigenous Services Canada.
It seems to me that between the provincial stockpile, the national stockpile, and this other stream of funding for Indigenous communities to buy their own PPE, we really have a challenging time determining how much each community benefited from this, whether they were able to buy adequate PPE, and whether government did its job, essentially. Is the complexity and the kind of interjurisdictional element a challenge here that should be resolved for the next public health emergency that comes around?
I think you've hit on something that I mentioned when I tabled my reports back in March on pandemic preparedness, and it extends to personal protective equipment. It is that multi-jurisdictional responsibility around a health crisis, right? Health is managed by the provinces and territories, and in an emergency like the pandemic, the federal government steps in to provide additional support. And that's why we mentioned in that March report, and we also mentioned here about the need for information sharing agreements to be ironed out. And while those things hadn't happened prior to this pandemic, we did see that the provinces and territories and the federal government collaborated together in order to address the needs. But this is exactly one of those things that needs to be taken care of before the next emergency because it is complex, especially when Indigenous communities are involved, as they play an important role in a partnership in ensuring the health of Indigenous people and Indigenous communities.
Opératrice, nous pouvons passer à la prochaine question au téléphone.
Thank you. Merci. Our next question, Sherry Nareen Winspeaker. Your line is open. À vous la parole.
Thank you. You mentioned that budget constraints was one major factor that impacted the National Emergency Strategic Stockpile. Did budget constraints also impact the Indigenous Services Strategic Stockpile?
So Indigenous Service Canada had its own stockpile. Following the SARS pandemic, they had established a policy about how much of each type of protective equipment that they would have in their own stockpile. What we found prior to the pandemic is they weren't following their policy, and hence they were a little short of certain items like gloves and hand sanitizers when the pandemic broke out. However, if you look at cases in Indigenous communities, COVID cases in Indigenous communities, the demand didn't really hit Indigenous Services Canada in a significant way until the bulk procurement had started federally. And so Indigenous Services Canada was receiving 2% of all bulk procurements. We found throughout the audit that they were able to meet all of the requests that they received from Indigenous communities throughout the pandemic, as long as they were requesting things in line with the provincial guidelines. And so sometimes they did adjust the requests, but met all of those requests that were received.
Okay, and looking at long-standing issues, you mentioned that Indigenous services had trouble getting nurses and paramedics to meet the emergency demands. But when there's a non-emergency situation, has Indigenous Services Canada taken steps to address those long-standing issues?
That's exactly what we found, is that they had not, and that when you already start with a shortage of healthcare workers, the pandemic makes that gap even worse. And so what we found during the audit was that Indigenous Services Canada had streamlined its hiring processes for nurses in the 51 remote and isolated communities. They were able to hire more nurses in the audit period than they had hired the year before. And so we recommended to them that they should consider whether or not this streamlined approach is really something that should be used going forward. This longstanding issue, though, is one that does need to be addressed, and we see it in so many other places when we audit Indigenous services. We would have seen it in February in my audit on water quality, where they lack skilled water system operators. So it isn't just isolated to healthcare workers, and it is something that Indigenous Services Canada needs to address in collaboration with Indigenous communities so that we can fix the lack of skilled resources in those communities going forward.
Thank you.
Operator, going back to the next question on the phone.
Thank you. Merci. Our last question, Ryan Tumulty, National Post. Your line is open. À vous la parole.
Yeah, I'm wondering if you're planning follow-up audits to this process to see if the Public Health Agency corrects the problems that existed with the National Emergency Stockpile.
So we have so many pandemic-related audits on the horizon, at least in the next couple of years for sure. It might be something that we look at subsequent to that. I know that every department is responsible to provide an action plan to the Public Accounts Committee, and I would expect that the Public Accounts Committee will also do a follow-up on whether those actions are being taken. But I absolutely have on my horizon the need to look at how to be better prepared next time around. Whether that be increasing manufacturing capabilities within the country or addressing some of these long-standing issues. I just haven't really slotted it in my calendar yet, but it's definitely something I've been thinking a lot about.
And then, just as a follow-up, the 2002 and 2013 internal audits, I'm wondering if they were flagged at the ministerial level in terms of the concerns there. Did they rise to that level? And were the problems with the stockpile raised to the ministerial level at any point after 2013?
So I can't really speak to what would have happened back in 2010 and 2013 with these audits, but I can talk to you about what typically happens with an internal audit within a department or agency. The chief audit executive would need management sign-off on the findings and the recommendations, and management to include a response and an action plan to the recommendations. That would absolutely be given to the deputy minister. Traditionally, you would see the departmental audit committees also ensure that the chief audit exec is following up on not only Auditor General recommendations from external reports, but also internal audit recommendations. And so, based on that typical process of what I've seen in agencies and departments, I would expect that the deputy ministers would have been aware of that. Typically, departments post their internal audits as well on their website. I didn't go check if those were there, but that would be the typical process that would happen when an internal audit is published.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.